Welcome to the Exam Room Live, brought to you by the Physicians Committee. Hi, I am the weight loss champion, Chuck Carroll, and this is the healthiest half hour anywhere online today. Appreciate you joining us right here on Facebook and on YouTube as we close out the week. And today we are closing out the week and doing a show entirely devoted to you because we are going to attempt to bust some diet myths big time and crush that confusion, clear up that health picture as we open up the doctor's mailbag all show long. And prescribing answers for us today are doctors Neal Barnard and Dr. Jim Loomis is also making a digital house call with us today. Gentlemen, appreciate you being here. So if you have a question for either one of the good doctors, now is the time to go ahead and post that in the chat box or the comment section. We will be opening up that doctor's mailbag in just a little bit. You can also tweet them to us at Chuck Carroll, WLC, at PCRM. Just make sure that wherever you send it, you use that hashtag Exam Room Live. But before we get to the doctor's mailbag, let's get you caught up on the latest happenings. Here are your health headlines for Friday, October 30th, 2020. The U.S. now on pace to become the first country to record 9 million coronavirus cases today. It was just 2 weeks ago that the nation saw its 8 millionth case. And as we head into the holiday season, the rampant spread only appears to be accelerating. New infections reaching an all-time high Thursday, topping 90,000 for the first time, as more than 1,000 people died for a second consecutive day. In other COVID news, it turns out that one of the weirdest symptoms of the virus can persist for months in some patients. According to a new study, cases of COVID toes have been documented in patients for up to 150 days. The uncomfortable condition leaves toes painfully inflamed and discolored. COVID-19 also known to cause other ailments such as hives and scaly plaque buildup on the skin. Most dermatological symptoms, though, last for an average of 12 days, according to experts. And by the way, you can find a list of 6 ways to protect yourself or fight against the coronavirus and tips for boosting your immune system and combating those underlying conditions on our website, pcrm.org. Just look under the Health Topics tab and go ahead and click on coronavirus. And finally, today, we told you earlier this week about a proposal to limit junk food advertisements that are shown to children in the UK. The idea there, obviously, to combat childhood obesity. And now there is even more new evidence that the ads that they see have a massive influence over the foods that they choose. Scientists in Spain showing a popular cartoon to groups of children between the ages of 4 and 6. Some of the groups had ads for specific junk food. Some had fewer, some had no junk food ads whatsoever. And the researchers say the influence of those junk food ads was almost immeasurable. It was enormous, with children gravitating more toward foods that they saw on the screen. And interestingly, though, of the healthy advertisements that were shown, most of them featured female voices and characters. Interesting. All right, Q&A time here to close out the week here on the Exam Room Live. We are going to open up the doctor's mailbag. And as a reminder, if you have a question for Dr. Barnard or Dr. Loomis, go ahead and post that in the comment box, the chat box, whatever it is you want to call it. Just make sure that we fill up that doctor's mailbag because today's show is devoted entirely to you. And Dr. Loomis, we are actually going to start off with you today because of your athletic background. We have a question here from Olfa. She wants to know, do you recommend vegan protein powder? Is it safe?
So that's a question we get all the time about, do you need to supplement protein powder and are vegan protein powder safe? In general, really plants have protein. And again, there's a lot of misconceptions. It is true that athletes do need a little bit more protein than the more active you are, the more protein you need. An endurance athlete, the RDA for protein is about the recommended daily allowance. That's what RDA is. It's about 0.8, 0.9 grams per kilogram of ideal body weight. An endurance athlete might need 1.2 to 1.5. A strength training athlete might need closer to 2. The thing is, though, if you're training for a marathon, you're not eating 2,000 calories. You're eating 4,000 calories. And if the natural macronutrient ratios of a plant-based diet are about 15% plant-based protein. And if you do the math, so say you're, kind of reasonably active and you're eating a couple thousand calories a day and you're of average size, that actually turns out to be 15% protein actually turns out to be right in that wheelhouse of 0.8, 0.9 grams per kilogram. So if I'm training for a marathon and I'm running, and I'm eating 4,000 calories a day, well, guess what? my protein intake has doubled. So now I'm in that 1.6 range, exactly where I need to be as a strength trained athlete. So you just don't need to take extra protein in any form. And the problem with, now, some people, you might say, well, I'm in a hurry, I have a busy lifestyle, and so I don't really have time to eat things. So how about if I just, make a protein shake in the morning? I mean, there's nothing wrong with that. And in general, protein powders are safe. You do have to be careful, with added sugars and such as that. But the thing is, when when you're using protein powder instead of beans or lentils as your protein source, you're actually removing some of the most important nutrients that come with food, and that is the fiber and the phytonutrients and antioxidants and on. So, if you're in a pinch and you want to make a smoothie or a shake in the morning as a meal replacement, not as a supplement, I think it's okay to use a little protein powder now and again. But in general, we should really try to focus on getting our protein from food.
All right. Dr. Barnard, coming over to you. This one very appropriate given tomorrow is Halloween and candy will be in abundance. Kelly wants to know, are sugar addictions real? And if so, how can I fight them?
They are real. In fact, you can even show the brain effects of sugar on the first day of life. Believe it or not, researchers have taken newborn babies and they've dribbled a little sugar water into their mouths right in the hospital, just on the first day of life, because when nurses are going to do a little heel stick and get a drop of blood to do blood tests, babies always cry, they don't like the pain. And researchers discovered that you can dribble a little sugar into the mouth of the baby, they cry less. And it turns out that what's going on both in the babies and in adults using sugar or having sugary sodas is that the taste of sugar on the tongue triggers the release of opiates in the brain, which are natural, mild painkillers. But in addition, the opiate triggering in turn triggers the release of dopamine, which is the pleasure chemical. So it's relatively subtle. It doesn't have the strength of recreational drugs, but it is strong enough to keep you hooked. So what do you do about it? I guess the first thing to say is sugar comes in different forms. And I think the ones that are the worst or the most dangerous are the ones where there's a sugar fat mixture, like a pie or a cake or a donut, because the sugar lures you in and then the fat is where the calories are particularly concentrated. And that's what's going to raise your cholesterol. Whereas foods that have just some sugar without all that glop in them are going to be somewhat better. But if you really are hooked on it, you decide if it's an issue. If it is an issue, you might just set it aside rather than try to do it in moderation, because moderation is often a way to just get back into the same problem you have. Make sure that you're taking care of yourself in other ways. Get a good night's rest, get some exercise, because if you are sleep deprived, you are going to do anything the next day just to get through the day, and your sugar addiction is going to scream out really loud. So those are a few ideas.
Let's stick with you, Dr. Barnard. Next question. A lot of people love sugar. A lot of people love coffee. We have a question from Shelly. Wants to know, what about caffeine? Does Dr. Barnard drink a lot of coffee? And is it safe to drink more than 1 cup per day? Is that healthy?
Okay, fascinating question. First of all, I have to say I don't drink coffee at all. I just never acquired a taste for it, but that doesn't necessarily mean it's bad for you. The research is a little bit mixed. When you look at Alzheimer's disease, coffee probably reduces the risk. To get there, you have to have a fairly heroic amount, like 5 cups of coffee per day. But the association has seemed to hold up. On the other hand, there are negatives to caffeine. Caffeine can aggravate cardiac arrhythmias a little bit. It's not the biggest factor there. It can make sleep rocky, and it will change your personality. You might think it's great to be as talkative as you are at 8:30 in the morning, and your carpool may not agree with you. So those are some of the main issues with coffee. I think overall, caffeinated beverages are not the worst issue, but you don't need them.
Dr. Loomis, coming back to you, we talked a little bit about supplementing with protein, but here's another question specifically for athletes. This one is from Thomas. Wants to know, do you recommend endurance runners get extra vitamins or minerals?
Yeah, so that's another great question. There's really no evidence that any one specific vitamin or supplement enhances athletic performance or recovery. Now, there are some specific foods, things like beets, anything that activates nitric oxide can increase endurance because that increases blood flow. So that's things like beets and arugula and kale. There's some foods that have been shown that help with recovery, tart cherry juice, for example. Now, that being said, when I was training last year for Ironman triathlon, I'd suffered an injury. I tripped and fell and banged my knee and had a pretty significant bursitis. And I did use some turmeric, ginger, black pepper supplement, which has been shown to be anti-inflammatory. And there is some pretty good research around even people with like degenerative arthritis, chronic knee pain, chronic hip pain, that it may be as effective as the non-steroidal anti-inflammatories like ibuprofen without all the side effects. The other thing that I did take on occasion was an algae-based or a vegan omega-3 fatty acids. Omega-3s in our bodies are broken down to compounds that are precursors for anti-inflammatory chemicals, if you will, leukotrienes and prostaglandins, as opposed to omega-6s, which are inflammatory. So you really want to keep that ratio of omega-6, omega-3 ratio, fatty acids in your diet pretty low. Now you can do that by consuming foods like flaxseed, hemp seed, walnuts, things like that. But I did take a little bit of omega-3. Again, there's not a lot of really solid research around the use of these supplements and performance or recovery. Subjectively, I think I did feel better, especially after my little injury. But, in general, again, eating a well-balanced whole food plant-based diet should give you all the vitamins and nutrients and antioxidants and anti-inflammatory compounds you need to perform optimally.
All right, Dr. Barnard, bouncing back to you. This one may be maybe a tale of two evils. I really don't know how to classify this one. Somebody wants to know, how bad is butter and is it worse than milk? I don't drink milk and I rarely eat cheese, but I do eat butter. So they're looking for a little bit of guidance.
I would skip the butter. To make butter, obviously you take milk, which has a mixture of fat and some sugar in it, a lot of sugar, lactose sugar in the milk, and it has some protein and some other things in it. And to turn it into butter, you basically get rid of everything except for the fat. And the quality of the fat is what we're worried about. It's terrible. It's really high in saturated fat. And when you feed it to volunteers in carefully controlled research studies, you know what happens to their cholesterol levels? You guessed it. They go straight up. So butter is very tasty. But, if you get a good bread or you have good vegetables or other things that you're using the butter on, and you just decide to detox yourself from the butter, you'll find that after a while, not only do you not want it, but you specifically want to avoid it. So I would get away from the butter.
All right, Dr. Loomis, we're going to kind of piggyback on this one a little bit. Going to stick with the cholesterol note. Very interesting question, I think, from Wayne. He writes in, I've always known that animal products contain cholesterol and bad fats, but I've recently heard that certain food and drink can cause us to actually create our own bad cholesterol. Is this true? And if so, what are these foods and drinks?
Well, the cholesterol is a natural product that our bodies need to function. We need it. It plays a role in our in maintaining healthy cell walls in our body, and we need to have some cholesterol. And the body can, in fact, make plenty of its own cholesterol without the addition of dietary cholesterols. Now, in general, there is an association between elevated levels of LDL cholesterol, which is the bad cholesterol, and you really want to keep that in a minimum. Excuse me. In fact, it's felt the optimum level of LDL ratio for to optimally reduce your risk of coronary artery disease is a level in the 70s, 75 or less. And we do know that many foods, including some plant-based foods, can raise LDL mainly because of saturated fat, and in particular, it's really you have to be very careful with some of the edible oils. And I think that's true in general, things like corn oil, and especially the oils that have a lot of saturated fat, like coconut oil, for example. So in general, again, those, to me, I would not consider edible oils as part of a true whole, they're vegan, but I wouldn't consider that part of a true whole food plant-based diet, which is, it's vegan in the sense there's no animal products, but it also tries to really minimize the amount of processed food in your diet. And so, again, in general, sticking to a whole food plant-based diet and really being careful with the consumption of edible oils in your diet, in particular the ones that are higher in saturated fat, like coconut oil, but edible oils in general can raise LDL cholesterol.
Dr. Barnard, did you want to add to this?
So many people learn that our bodies do need some cholesterol, just as Dr. Loomis was saying, and they mistakenly think that we need to eat some cholesterol. So I need an egg to get its cholesterol, or I need a steak for its cholesterol. But as Dr. Loomis was saying, the body makes the cholesterol that it needs. So you don't need to add any at all. And if you do add cholesterol through an egg or other animal products, your blood cholesterol tends to rise, and you don't want that. So cholesterol plays important roles in the body, but your body makes the cholesterol that you need, and you don't need to add any.
All right, let's jump from cholesterol to calcium. Sticking with you, Dr. Barnard, question from Elaine. What would you say to people who say you need to drink milk in order to get calcium?
Well, it's important to remember that even though you do need calcium for bones and lots of other things, I guess a couple things should be said. The first is you don't need as much as you might have heard. You'll hear people say you need 1,000 milligrams a day or 1,200 milligrams a day. When you look through the research on it, it's pretty hard to make a case for getting more than about 600 milligrams a day. The reason I say that is when you are at that level, you just don't see a higher incidence of fractures for people who are a higher or lower incidence of fractures, depending on variations above that level. So in other words, if you're having 600 or 700 or 800 milligrams a day, to get to 1,500 is not going to make your bones stronger. But the other thing about it is, where does calcium come from? Cows don't actually make it. The calcium that is in milk came into the cow through the cow's diet. The cow is eating grass, and the grass roots pull the calcium out of the soil, and it ends up in the green vegetable that the cow eats, grass. Hopefully you're not eating grass, but if you're eating broccoli or kale or collards, you're getting that green vegetable, and that gives you calcium in its natural source. So green vegetables are the natural source of it, and you're frankly better off getting them that way, because all the things that go along with it in the green vegetable are far better than the things that come along with calcium in milk, like cholesterol and hormones and fat and that kind of thing.
There you go. As a reminder, if you have a question for either Dr. Barnard or Dr. Loomis, you can tweet that to us using the hashtag ExamRoomLive. Dr. Loomis, this question comes to us from Linda. She says, I've been suffering with psoriasis and now psoriatic joint pain. Do you have any suggestions for my diet?
Yes, so that's a great question. And so psoriasis is felt to be an autoimmune disease. We don't really know what triggers it. There's some evidence it might be a kind of a hyper immune response to certain viral infections, and it causes kind of a plaque-like rash, which can be very debilitating, actually. People with extensive psoriasis, they're embarrassed to go outside because they have these, their skin doesn't look very pretty. And in advanced cases, it can actually cause a form of arthritis. It actually causes inflammation of the joints. There is some evidence that many autoimmune diseases will in fact get better from by adapting an anti-inflammatory whole food plant-based diet. And I think there's two factors at work here. And I have in fact seen many patients in our practice at Barnard Medical Center who have actually even reversed or put their psoriasis into remission with a strict whole food plant-based diet, particularly getting rid of the dairy products. That seems to be one of the triggers. And just the way I kind of think about this when I talk about my patients is, think about your body as a house. In each room in the house is an organ system. So we have a brain room, we have a skin room, we have a respiratory room, we have a joint room, we have a cardiovascular room. And when we eat kind of a standard Western diet, which is highly inflammatory, we fill our house up with angry people. And you can imagine if a stranger wandered into the house or into a particular room, it wouldn't be a good outcome. So, for example, and depending on the nature of the stranger and what room dictates the clinical state. So they come in the thyroid room, you've got thyroiditis, Hashimoto's. They come in the skin room, you've got eczema or psoriasis. They come in the respiratory room, you've got asthma or allergies. They come in the joint room, you've got rheumatoid arthritis or osteoarthritis. So where are these strangers coming from? Well, it turns out they're probably coming in from our gut. And it's fundamentally related to a disrupted gut microbiome. And we do a lot of things to disrupt our gut microbiome. Babies are born with a sterile gut, then we have a vaginal delivery, then we breastfeed, and the rest of our lives we got our food out of the dirt, we played in the dirt, we got our water that had bacteria in it. We've completely disrupted that whole system. We C-section babies, we don't breastfeed anymore. We put so much pollution, we put so many pesticides and herbicides on our food, we have to scrub the dirt off. We pollute the water, so we have to chlorinate it. We pass out antibiotics like they're candy. So, and then we eat a high-fat, highly processed food, which further disrupts our gut bacteria. And the gut bacteria play a very important role in maintaining gut health and maintaining decreasing gut permeability, so the gut doesn't leak. And when we live a fairly unhealthy lifestyle and populate our gut with unhealthy bacteria, the gut can leak these protein antigens. Remember, we swallow a lot of good stuff, nutrients, but we also swallow a lot of bad stuff. Bacteria, viruses, there's a lot of protein antigens that we really aren't designed to absorb into our bodies at high levels, like gluten and milk proteins. And so when we transition to a whole food plant-based diet, two things happen. The first thing that happens is it's highly inflammatory. So you kick all the angry people out of the house. And then second of all, and this may take a little bit longer, but usually in a few weeks to a few months, you will actually reset your gut microbiome. So now you've shut the front door to these strangers who are wandering in the house and creating all this havoc. That's a fairly kind of simplistic way, but I think there's something to that. And although there's not a ton of research directly looking at psoriasis, for example, there's a lot of research looking at, in fact, some which has been done at PCRM, looking at other autoimmune diseases, for example, rheumatoid arthritis. So certainly it's not going to hurt anything. And again, in my experience, people have had tremendous, really life-changing improvements in their psoriasis after they've adapted a whole food plant-based diet, in particular giving up dairy. That's probably the one thing that I would recommend for sure.
Strangers in the house. That is a nice analogy. You're so good with that. Dr. Barnard, here's one for you. Maybe you have an analogy for iodine. This question comes to us from Daryl. He writes that my doctor says I am low thyroid, but I've been using iodized salt, so I don't think I'm low in iodine. So what could be causing this?
Oh, great question. Many people are low they have low thyroid, they're hypothyroid, and worldwide the reason that you gave is the reason that people are low in iodine. However, in the United States, the biggest reason is actually not a lack of iodine, it's antibodies. Antibodies form in your body. Their normal job is to attack viruses or bacteria, but they can also attack the thyroid. And when they reduce the thyroid's ability to produce thyroid hormone, that is a condition called Hashimoto's thyroiditis. It's the big reason for low thyroid in the United States. So researchers at the Adventist Health Study started looking at diet patterns, and it was amazing. The people who were at the least risk for hypothyroidism were people following completely vegan diets. And the people at the greatest risk, surprisingly enough, were lacto-ovo vegetarians. And they're not eating any meat, but they're making up for it with cheese and yogurt and so forth. And the hypothesis has been generated that the dairy proteins in the daily diet are triggering the formation of antibodies. It's as if your body recognizes the dairy protein as an invader. It makes antibodies to it, and those antibodies are attacking the thyroid. Now, this is a theory, and it has not been tested in a randomized trial yet. But a lot of individuals are not waiting. They're going ahead and trying it on their own. And some of them do find that their thyroids get better. So don't cancel your doctor's appointment and don't throw away your medications if you're taking them. but do talk with your doctor or caregiver about the possibility of using a plant-based diet to see if it might help with hypothyroidism. And some people are doing the very same strategy for hyperthyroidism as well.
And you cover a lot of this in your book, Your Body in Balance.
Yes, thyroid diseases are so common, and people feel they're gaining weight, they're feeling sluggish, they can't figure out why. And the thyroid is often a big reason. It's a big issue and relatively simple to understand and to get back in balance.
Yeah, and I don't know if I told you this or not, but when we did the series of Your Body in Balance shows this past January, the thyroid episodes were a couple of the most downloaded. So clearly a lot of people are wondering about this issue. So they're very grateful to be getting this information today. Got time for a couple more questions here, Dr. Barnard. I want to stick with you. Interesting one from Lori. This is a medical school myth question. She says, is it true that pediatricians get more nutrition training than other physicians?
You would think that they might be more interested in nutrition because to develop a baby's brain and overall health, you want them to eat in a particularly healthy way. But the answer to your question is they don't get any more education. And the nutrition education in medical schools has sort of been inching up in a rather begrudging way over recent years, but it is nowhere where it needs to be. And that's why here at the Physicians Committee, we actually make something called the Nutrition Guide for Clinicians available to every medical student in the United States. In fact, you don't have to be a medical student. You can access it on your iPhone or your Android. It's a free app called the Nutrition Guide for Clinicians. And we're trying to make up for the lack of nutrition training in medical schools.
All right, Dr. Loomis, you were talking about gut health with the last question. Emily has a follow-up to that. She wants to know, are fermented foods necessary for good health, and how often should we be eating them?
So, yeah, I think fermented foods are an excellent way to attain and maintain good gut health. Fermented foods, and now I'm not talking about the dill pickles that have been pasteurized that you buy off the shelf. I'm talking about lacto-fermented vegetables, pickles, things like kimchi, sauerkraut, which are quite easy to make, by the way, at home. You can make them in a mason jar on your counter. Now, a couple caveats. There is some evidence that very high intakes of things like kimchi, and I'm talking about the traditionally made kimchi, which is in a big pot that sits in the ground and the way that's made in Korea. There is some evidence that high intake of kimchi may increase risk for gastric cancer, and also some of these fermented foods have a lot of salt. So I think again, it's really about thinking about it as part of a healthy dietary pattern, and having fermented foods once or twice a week is probably not going to increase your risk of things like gastric cancer. It's probably not going to give enough salt to really make that much of a difference, especially if you just, again, you have kimchi or sauerkraut or pickles one day, and then you just really watch your salt closely the next couple of days. So it's really about looking at your overall dietary patterns. And so I think they do play an important role. Probably the best thing to maintain the best foods you can eat to develop a healthy gut microbiome are actually things like legumes. The soluble fiber in those legumes serves as what's called a prebiotic to help develop a healthy gut microbiome. And I always recommend Dr. B's book, Fiber Fueled. He's been on the podcast, I know for sure, in the past. And that's a great book that really explains about how to develop and maintain the importance of and how to develop and maintain a healthy gut microbiome.
That's Dr. Will Bolsowitz, amazing doctor. Love having him on the show. He's so much fun to talk to. Dr. Loomis, final question for you. Are you a dehydrated food fan? Because Lynn is asking if dehydrated foods such as tomatoes lose any nutritional value.
I do dehydrate some foods. I haven't played around with dehydrated tomatoes. I don't know of any evidence. Just, theoretically, again, if you look at the difference between raw and cooked foods, and so theoretically, dehydrating tomatoes is slow cooks them, if you will, at a low temperature. There's some evidence that it may lower the vitamin C in the food, but it increases the lycopene. which is one of the powerful antioxidants, polyphenols, that has been shown, for example, to help maybe decrease the risk of prostate cancer in men. Now, one caveat about dehydrated foods, though, especially fruits. When you dehydrate a fruit, you really concentrate that sugar and you decrease the volume, right? So, you wouldn't sit down and eat 10 apricots, in a sitting. But it's very easy to sit down and eat 10 dehydrated apricots. And so the amount of sugar that you get with dehydrated foods can be quite a lot, dehydrated fruits in particular. So you don't lose fiber, it's still a health food, but you just have to be careful because the dehydration, when you dehydrate, obviously it moves water, and water provides most of the bulk of the food in the food. It can be easy to overconsume dehydrated fruits in particular and overconsume calories. So you do need to be a little bit careful about that. But I have a dehydrator at home, and I dehydrate. I make banana chips and plantain chips and apple rings and pear rings, and haven't done many vegetables, although that's a project I've set for myself this winter, is to play around with that. So.
All right. Final question, Dr. Barnard. This one comes to you. This was a question from Malu. It's been asked many times, so I'm glad that we're going to get a chance to answer it. Is it true that some brands and forms of vitamin B12 are better than others? And what brand would you recommend?
Okay. There are two main types of B12. One is cyanocobalamin. The other is methylcobalamin. The one that the body is really looking for is methylcobalamin. My understanding is that the cyanocobalamin adds a teeny tiny trace of cyanide. Sounds frightening, but it increases the shelf value, and the amount is so trivial that it has really no physiologic effect. So they both work. They're really equivalent. The methylcobalamin is the one that I would have to say is more physiologic, but they both are going to work fine. With regard to which actual brand you choose, I wouldn't worry so much about that. I would focus on the dose. The amount you actually need is 2.4 micrograms a day. And if you go off to the health food store, they've got 500 micrograms a day and 1,000 and 5,000. And it's amounts that you don't probably need. So pick the smallest one that you can find and take it every day. Those really larger doses can be used for people who have serious issues, physiologic issues with regard to absorption, and they're used to make up for lost time. But for a healthy person, get a smaller one, 100 or 200 micrograms a day would be appropriate. Take it every day, and you should be all right.
Fantastic. If we did not get to your question today, have no fear. We will save them. We will do our best to get you an answer from either Dr. Barnard or Dr. Loomis or one of our other experts on an upcoming episode. So keep on posting them in the comments section or in the chat box. I promise you, we do read each and every single one that comes in. Dr. Barnard, Dr. Loomis, thank you guys both very much for your time today. This has been enlightening as always.
Thank you, Chuck.
Yeah, thanks, Chuck. Always a pleasure to be here.
All right, you guys have a wonderful weekend and a happy early World Vegan Day. That happens to be Sunday, as a matter of fact. So happy World Vegan Day.
Chuck, every day is vegan.
I like the way you think. Oh, man. Speaking of World Vegan Day, I also want to say hi to Exam Rumi watching us in Adelaide, Australia. A woman by the name of Rebecca tunes in all the time. She used to live here in the Washington, D.C. area, but now she moved home to Australia. Well, she got the go-ahead to safely do a vegan event on Sunday to celebrate World Vegan Day. So thank you, Rebecca, for watching the show and telling the world down under about the benefits of a plant-based diet. That is tremendous. And if you found benefit to this show today, my friend, go ahead. If you haven't already done so, subscribe to the Physicians Committee's YouTube channel and like them on Facebook. That way, when we go live every single weekday, Monday through Friday at noon Eastern, you will get an alert that says, hey, it is time to raise that nutrition IQ, my friend. So go ahead and do that right now. By the way, what are you doing to celebrate World Vegan Day? Are you going to be whipping up something tasty in the kitchen, a nice plant-based meal? Well, if you're in need of a recipe, one place that you can go to find that actually could be over at letsbeatbreastcancer.org, because over on that website, you will find 4 steps that you can take right now to lower your risk of breast cancer. And you can actually sign up and say, yes, I will follow those steps that you have identified to help me lower my risk of breast cancer. And when you do that, you will also receive a free cancer fighting e-cookbook filled with recipes specifically designed to lower your risk of cancer. So what a great combination. You celebrate World Vegan Day and you lower that risk of cancer. And as the bonus, you know it's going to be tasty. So that's over at letsbeatbreastcancer.org. And this is October. So, of course, we are in the midst of our Let's Beat Breast Cancer campaign 2020. That's in the home stretch. And we couldn't have pulled that off this year without the work of our tremendous sponsors like Switch. So thank you very much to Switch for their support and everyone else who contributed to the Let's Beat Breast Cancer campaign to help make the world a healthier place. And as I mentioned, yesterday's Exam Room podcast, it featured Dr. Christy Funk speaking about breast cancer. She and I actually had the opportunity to talk about 3 sneaky risk factors when it comes to breast cancer, some things that you may not have thought about that increase your risk. And so then what steps can you take to combat that, to bring down that risk? Well, if you head over to Apple Podcast or Spotify, go ahead and subscribe to the Exam Room by the Physicians Committee. Leave that 5-star rating. You'll automatically start getting those episodes as well. And also part of that discussion, very interesting to hear her talk about how the COVID pandemic is affecting women's health and how so many women are actually postponing screenings and treatments for breast cancer. So it's a very important and enlightening conversation. Head over, check out the Exam Room podcast for that. But for today, that is all the time that we have. I want to thank you so very much for tuning in, my Exam Roomie. Appreciate you being here. And a big tip of the cap to the crew behind the scenes that makes the show the wonder that it is. Thank you both very much for your help. And Dr. Jim Loomis, Dr. Neal Barnard, thank you as always for your wisdom and your time and helping us to raise our collective nutrition IQ. On behalf of everyone here at the Physicians Committee, I am the weight loss champion, Chuck Carroll. Have a wonderful weekend and a wonderful World Vegan Day. We will talk to you again on Monday. And until then, stay safe, take a stand, and keep it plant-based.